Association of Public and Environmental Health Officers on Saturday, 11 June, updates the media about the sit-down strike they are currently embarking on. Speaking to journalists, the Vice President of the association, Musange, tells what prompted the ongoing strike.
On April 6, 2022, public health officers around the country went on a sit-down strike as the result of what? The enfranchised treatment and lack of government payment of on-call, specialty, risk and responsibility allowances as promised. The industrial action by the public officers led to the call of an urgent Congress where members converged and discussed extensively on the matter. In the interim, the association executive had a meeting with the former Secretary General and Head of Civil Service, who promised in writing to make sure the allowances are paid by end of May 2022. Again, a press conference was summoned by the executive to communicate that the first phase of the strike will be called off awaiting the end of May 2020.
He informs that following the cabinet change, his executive wrote to the current Secretary General requesting a meeting to discuss the allowance status.
Following the cabinet change, the executive wrote to the current SG on May 17, 2022 to request a meeting to discuss the allowance status. Still, after repeated follow-ups, we received no response. The executive again wrote to the Secretary General on May 25, 2022 to remind her and her valuable office of the April 22 agreement written between her office and then the organization. The following individuals were copied in the letter described above: Minister of Health, Office of the PMO, Permanent Secretary, Minister of Health, Registrar of Public Health Council, Director of Public Health Services, Director of Human Resources, and Director of Finance, Minister of Health. Up to date, the executive of the, has not received any form of official feedback or allowance payment from the letters written to the authorities concerned.
He further discloses the impact of industrial action on public health.
Currently, in the country, the number of clinics cancelled is about 124, which has given almost 100 kids in the Gambia missing their 100,000 children in the Gambia missing their vaccination. No surveillance activity, no bar registration, no participatory health and hygiene education in the community. Suspected cases of outbreaks: measles, currently we have 11 suspects. Monkeypox, we have 2 suspects. AFP, polio, we have 1 suspect. Rabies, we have 1 case. And in the viral hemorrhagic fever, we have 2 cases have not been followed up or investigated because the public health officers are on strike.
Jibril Gandabalde, the public relations officer of the association, had this to say.
We have been promised since last month, as we all know, in May, we made a strike in April that was 6, and then the strike was called off due to an agreement, a gentleman agreement, and also a written agreement, both agreements. And then we called off the strike, and they promised, when we called off the strike in April, end of April, yes, we will not be able to get paid because it was way beyond the time that will be allowed for payment to be disbursed. But we were promised, come May, end of May, all the allowances that we are claiming will be paid to the public health officers, and which did not happen. Because the allowances we are claiming for, is very important for people to know that these are allowances that have been given to our colleagues in the Ministry of Health, though different cadres like nurses and doctors. And these allowances are responsibility allowances, on-call allowances, and special skill allowances, and risk allowance. So all these 4 allowances, we feel every staff of the Ministry of Health is entitled to.
The Assistant Social Secretary, Mohammed Keita, says the public should hold the Ministry of Health accountable for the strike.
If the public want to blame anyone, let them blame the Ministry of Health. Let them blame the minister, let them blame the SMT of the Ministry of Health for not adhering to what they promised us, and for not writing to us, and for not responding to any of our letters.
The Association of Public and Environmental Health Officers of the Gambia, established in 1971, is a registered non-profitable organization serving the interests of public health professionals in the country. Its main objective is to enable public health officers to deliver quality service to the Gambian people. Reporting for Kerr Fatou, I am Ramatulai Jao.